We would like to thank our sponsors for making this another successful year for the Mathew Forbes Romer Foundation. Our foundation provides education and funds research of children's genetic diseases of the brain. We have driven 12 years of research, now leading into clinical trials, helping raise millions of dollars to fund these breakthroughs.
Soy Alex Fernández, mi esposa Hilda Fernández y nuestro hijo Cristian Manuel, cual tiene Tay-Sachs.
There is an intimate relation between caring and curing.
Christian was born a healthy, vibrant boy, because Christian did crawl. Christian did get up in his crib and took steps. And as he started to develop, around 3 to 6 months, we started to notice slight developmental delays. On March 27, 2012, we got the dreaded diagnosis that our son had a terminal, non-treatable, non-curable disease called Tay-Sachs. It was the worst day of our life, and I think will be the worst day of our life. And the pain was unbearable. I also, at the same time, remember telling my wife that this disease and this situation that we now are faced with would not change our life, would not change who we are, not change our family, more importantly. I reached out to the NTSAD, of which we got a plethora of information and things that were happening, and of course then through meeting Kevin, I was introduced to Mathew Forbes Romer Foundation.
Together with the National Tay-Sachs and Allied Diseases Association, our families, as well as people who support them, are benefiting from the film, Parenting a Child with Life-Limiting Illness. Many of our families are featured and share their stories to help others.
My child was born normal, he was born healthy. And for me to get a diagnosis that he wasn't going to live very long was just, it was unbearable.
Well, I think it's safe to say that we were devastated and shocked, and it's hard to look at a living being that is as beautiful as a 5.5-month-old child and realize that she's going to die sometime in the next 2 years.
Over the past 10 years, the Mathew Forbes Romer Foundation has funded more than 20 important nursing school scholarships. Customizing care programs that adapt to the unique needs of a family are key to the new programs we've launched in the home. Given the intensive care demands of these affected families, we are working with leading institutions in South Florida, including Florida International and Florida Atlantic universities, to assess the needs while training nurses to support these care plans.
To be able to take these nurses out into the community and teach them how to be with these patients, with these persons in the community where they are, is what we would call the lived experience. We go to them and we learn to be with them.
It's a learning experience for the nurses, caring for children in the community, as well as providing unique opportunity to serve families in the community, especially those that have special needs children.
It's good to know that we can count on the program and a student nurse to help us when we need to.
I feel that we will be able to reach out to the community and learn about these diseases and not be afraid of these diseases and help those that really, really do need our services as nurses.
A top priority is caring for future parents before they establish a family. Here is where education of risks and screening for the presence of defective genes that lead to these horrible diseases are so critical. Since 2003, our reach continues to grow with the South Florida Genetic Testing Program, having screened over 1,000 potential parents with over a 20% detection rate. Our screening partnership with the Victor Center expanded to include the Miami Children's Hospital Genetics Department and Brain Institute. We are beginning to work with the J-Screen program, promoting and offering screening for many diseases online and from your home. Medical science has proven time and again that when the resources are provided, great progress in the treatment, cure, and prevention of disease can occur. In 2002, the Mathew Forbes Romer Foundation, in partnership with the National Tay-Sachs and Allied Diseases Association, founded the Research Initiative, resulting in 41 projects and $2.9 million in grant awards. Several projects have led to larger National Institutes of Health grants, resulting in over $10 million towards our goal. In 2007, we helped establish the Tay-Sachs Gene Therapy Consortium with a plan to get to clinical trials with an international team.
We announced that we were hoping and targeting to be in clinical trials in 2013, but then we had a setback. We learned a very valuable lesson. We learned that the gene therapy treatment in preclinical trials was working so well as we applied it to monkeys and primates that it could have a toxic effect. And that was unprecedented findings. And so thanks to the wonderful work of the University of Florida as part of our consortium, we were able to redesign experiments and that'll ensure better safety and efficacy data and a higher degree of confidence as we move forward to clinical trials.
We just feel that each day is a blessing now with him, and we just want to cherish each and every day.
Time to pay homage to our See the Light Award honorees, who are on the forefront of caring and curing. When it comes to caring, Dean Marlene Smith and her team at the Florida Atlantic University Christine E. Lynn College of Nursing in Palm Beach County have maintained a partnership with the Mathew Forbes Romer Foundation since 2003.
The Christine E. Lynn College of Nursing is dedicated to caring, advancing the science, practicing the art, studying its meaning, and living caring day to day.
They created the prototype for administering nursing scholarships focused on pediatrics and genetics.
Since the foundation was really focused on education and advancing education about children with genetic diseases of the brain. And so we're launching this project, we're very excited about it, where we will have our students in the homes of families where a child has a genetic disease of the brain. And the students will be able to learn more about what the families are experiencing. You know, learn to care in better ways for families like this.
Once again, Dean Smith and FAU are helping us to pioneer a new program that epitomizes the care needs of our families.
We hope to expand this so that we may have multiple students working with multiple families in the community, and we'll really be able to make a difference.
Our See the Light Award recipient, Dr. Marlene Smith. Our next honoree demonstrates the extended reach we have with our partnerships in South Florida. Dr. Ora Strickland is Dean and Professor of the College of Nursing and Health Sciences at Florida International University in Miami. Dr. Strickland is one of the founders of the National Institute of Health's National Institute for Nursing Research. With the breadth of experience, she has led the launch and growth of a new nursing and health sciences building, which includes the Mathew Forbes Romer Foundation Pediatric Evaluation Lab.
We're very grateful to the foundation for providing us with this opportunity, and our students are most fortunate to have it.
FIU expanded the Mathew Forbes Romer Foundation Nursing Scholarship Program with the second largest number of scholarships.
Healthcare is moving outside of the hospital into the community, into the personal spaces of people who need their care. People with chronic diseases, young children. This program focuses on providing our students with important experiences with children with special needs in their homes, in their communities.
Dean Strickland is helping us to pioneer the new program that epitomizes the care needs of our families. See the Light Award recipient, Dr. Ora Strickland. We are so fortunate to have the expertise and resources of the world-renowned PAL Gene Therapy Center Toxicology team at the University of Florida College of Medicine, under the leadership of our next honoree, Dr. Thomas Conlon. Dr. Conlon's work with the International Tay-Sachs Gene Therapy Consortium has been vital to this cause.
I'm encouraged with these results within these studies because what we did find was there was a side effect within the animal that would not have been found necessarily if we went straight into people. Because of these results, we know that we need to go back and make a few adjustments to the gene therapy vector itself and reperform these tests so that the patients may get the safest and most effective therapy in this clinical trial.
The Food and Drug Administration is depending on this toxicology analysis for granting its future approvals and for new drug applications.
My greatest hope for leading this research effort is really to find a one-time cure-all for patients with Tay-Sachs disease. The goal of gene therapy really is that one-time treatment with a patient of a genetic disease that lasts a lifetime without repeated infusions or therapies that many of the genetic diseases require at this time.
Our See the Light Award recipient, Dr. Thomas Conlon.